I'm Lisa Upledger. I'm a chiropractor, and I mostly was in the practice of craniosacral therapy, which I mixed with chiropractic and whatever other kinds of techniques. I'm also in Florida. As I put it, I am legal to use needles. I was able in Florida, the state of Florida, to take a course and then a state exam, which allowed me to use needles in my practice. I would never call myself an acupuncturist. That's definitely a career study, but I incorporated that with the chiropractic, with the craniosacral, with the acupuncture. And definitely kind of started my background. What got me to go to chiropractic school was applied kinesiology, which is basically people know it as a muscle testing, but that was the work of Dr. George Goodhart, who was a chiropractor. And that's what intrigued me and got me to really go to chiropractic school. And so I started my career a lot with doing what now would be called functional medicine and the muscle testing and that kind of thing. But when I hit craniosacral therapy, I went, okay, that's it. That's what I want to do. It just grabbed me. I thought it was phenomenal because I found craniosacral therapy to be able to give me insight into bodies in a way that nothing else could, and information came directly from the body to the practitioner, and it allowed me to understand what was going on in the body as opposed to trying to think what might be happening and create a story, but to get the story and the information right from the body itself, and to give me the story and understanding about what was going on. And over the years, just adding, all the study, all the years of practice, I was in practice for 41 years. I retired at the end of September. I still see a few people here and there, but I am teaching. I'm just starting to teach just some of my own courses, my own classes that I devised. I was at the Upledger. I was married to Dr. John Upledger, who passed away in 2012. And he, of course, is the founder, creator of this body of work of Upledger Craniosacral Therapy. I was at the Upledger Institute for 22 years. I left in 2013 and kind of on my own and teaching. And the Dolphins, I was introduced to them, I can't remember now, maybe 3-4 years ago, and used them in my practice very much. So one of the big things for me was scar tissue. Scar tissue. I used to say it was her nemesis. They put it on my tombstone. Scar tissue, her nemesis, she fought it all her life. That was going to be on my tombstone because scar tissue was such an issue in bodies. And I'd put needles in, and of course, castor oil packs and whatever, all different kinds of things. And then I got introduced to the Dolphins. It came from 3 different massage therapists all around the same time. And they said, you got to do these, you got to use these. So, and then it was from 3 people who I admire and respect greatly. And so I said, okay, got to try these things out. Got a pair of Dolphins and was just amazed how finally something changed and went through that scar tissue and opened it up. Because scar tissue in bodies just absolutely wreaks havoc and is such an underlying problem with what we call inactive lesions that the body has to adapt around, because it can't dissipate it. It can't get rid of it entirely. It can't do that because that tissue has been denatured. It's changed. So the Dolphins come along and they are able to get through and help to change the polarity and open that up. So it's not the issue in the body that it normally is. Meridians can now flow, chi can flow, energy can flow, it's almost like they can breathe again and they can open it up. The craniosacral rhythm comes back to the area much stronger. Fluids come back into the area as they absolutely essential. You've got to get the oxygen in there from the red blood cells. You've got to be able to wash away those metabolic byproducts. Got to get the lymph to flow. And what I noticed with the dolphins is, I'll assess a patient the way that I do with the craniosacral and start to work. And if there's a scar or something in the way, or if there's adhesions deep in because of an impact, if there's tissues that have been so contracted for so long, I'll even do the scar protocol just through those tissues, and things start to open up, and it completely changes the session. It completely, now when I go back and reassess, it's a whole different session and opened up. And I love it because even those people on my table who rarely felt much, they will very often feel that after using the dolphin and how things have opened and expanded. And for me, it just took all this time of me just kind of sitting there and kind of pumping energy in, or sending somebody to an acupuncturist to get lots of treatment, or me doing what I do with acupuncture with using the needles. Again, I'm not an acupuncturist, but I can use needles in Florida, and opening that whole area up. The dolphins just do it quicker, and it just saved me so much time and energy. I was just so appreciative of that. And we were talking about concussion, and of course, skull bones, those intricate sutures that can get so jammed on impacts, and being able to get them open, and then with the kind of skull bone releases that I do, just finally getting them open and to move and get the rhythm, it just changes everything instantly. And so I use them through the skull. I use them everywhere. Again, those skulls, the inside lining is the lining of the dura mater that folds on itself for those intracranial membranes where those strain patterns are. Now you can really start to get those to release, and that will start to help to heal, of course, the brain tissue. Now you can get better venous drainage, you can get better circulation, and the lymphatic system moving better. So now that brain tissue can start to heal, which has been bruised and impacted in concussions. So all of that is absolutely essential. But when you feel concussed heads, it's a shock. It's such an intense shock, and those impacts of the energy that are in there, but how to get that all moving again, how to get that open, how to get that freed up. And because of the way that we palpate in craniosacral therapy, which my husband called blending, and it's almost like, as he would describe it, putting your hands underneath the skin and touching inside a body and feeling that cranial rhythm, I've learned to be able to palpate energy and feel this, that I can feel the energy that the dolphins put through. So I don't even have to really kind of follow protocols in a way, because I can feel that energy. I can direct, that's the beauty of it. I can direct the energy of those dolphins going where I want it to. I know that it's gotten through that scar. I know it's moved through things. I know it's opened up that meridian. I know I've gotten deep and gotten to it where I need to. I know I've gone through lungs with adhesions, and gotten things in and gotten it opened up. That for me is just, it's just such an extension of my hands and what I'm feeling, and just being able to hone in, and whatever that is, I've tried a lot of different things over the years, but the dolphins are, what is it? Because it's a direct current. Is that the difference that makes all the difference? That, these work, it's brilliant, it's beautiful, and I love them. So, I always bring them out. I always bring them along because, I'm getting up there in those years, and I don't have the energies anymore to just kind of sit there and pump through, which doesn't change the polarity of the scar tissue anyway. But now I just constantly pull out, get that energy through. It opens it up, saves me a whole lot of time and energy, and I love that. And I love that. So I bring them with me when I teach. And like I say, I treat a few people here still in there. I just retired in September after 41 years. And, so I've always got my dolphins with me. I was just in Utah teaching. And one of the students there had gotten the dolphins because I was there a couple of years ago teaching. But she had the vagal. So I did get to, she let me use it for a few nights just on myself. And I could instantly feel that difference. And I know already in treating people, it will make a difference because immediately you bring that on, because it's all about taking that on and taking the stress out of the autonomic nervous system. And it's all about balancing that. So I could feel with the vagal, the autonomic nervous system just dropping and coming down, which was fabulous. And that'll already open somebody up immediately. So when you start working, you've already got that. You already have that autonomic nervous system relaxed and down. And that's gonna make a huge difference. That's gonna change things. So I'm looking forward to playing with that, and that'll be fabulous. That's why I love craniosacral therapy so much. It's the environment, it's the housing for the central nervous system. It's so, even if the brain is good, what good is putting, I tell my students, I say, what's good putting beautiful furniture in a home if the roof is leaking and the foundation's cracked and the walls are crumbling, if the environment, the air is really horrible in there, the environment is so important to be taken care of, and we've got to take those stresses out of the intracranial membrane system, out of the dural tube, out of the, to give as much freedom and expression to the central nervous system as possible. That's when you have health, and that's when you have health and well-being. So yeah, I love using the dolphins through those jammed up cranial sutures and plates, and getting things open, and contracted dura. The dura, particularly lining the periosteum, and that gets contracted, and being able to open that up, and then I can work with it and get it freed up. And it's beautiful. It's beautiful.